Hello, my name is Julian Pohl. I'm a medical doctor in Berlin at the Charité, and today I want to present you our work evolving patterns in the clinical burden of cirrhosis. There's emerging evidence highlighting changes in the burden of cirrhosis. Therefore, we conducted this retrospective study at our hospital and assessed the trends of mortality and hospitalizations in cirrhosis. We have seen that over the last 12 years, the number of total patient admissions with cirrhosis were decreasing. Especially since 2020, we have seen a stronger downwards trend regarding the total admission numbers with cirrhosis. In total, cirrhosis admissions decreased by over 1/5. While patient numbers were decreasing, we have also seen an increase in mortality, especially over the last 5 years. Since the COVID pandemic, mortality trends were aggravated, and since 2021, cirrhosis overtook chronic heart failure as the disease with the highest in-hospital mortality. Moreover, we observed that the proportion of cirrhosis admissions with acute complications was increasing, especially for ascites and bacterial infections other than bacterial peritonitis. Admission proportions increased by 25% and 39% respectively. We also observed that the mean age of admission was the lowest for cirrhosis patients. Interestingly, we have seen over time that the mean admission age was almost the same over the last 12 years, while for other chronic health conditions such as chronic renal and heart diseases, we have seen a steady increase in mean admission age, indicating that we might already have better prevention and out-of-hospital treatment options available for these chronic health conditions. Lastly, we observed a clear impact of the COVID pandemic on cirrhosis patients. We have seen a big impact of COVID on all chronic health conditions we assessed, but COVID had the strongest impact on cirrhosis. In December 2020, when COVID reached its peak in Germany, we observed also a peak for in-hospital mortality of cirrhosis patients, which then peaked at 15%. To conclude, while we have seen falling numbers of total cirrhosis admissions in our hospital, the density of severely ill cirrhosis patients was increasing, characterized by in-hospital mortality and proportions of acute complications. Therefore, we think that these results underscore the need for further risk stratification and adapted management strategies in cirrhosis.